Welcome to the Heart Rhythm Center. In today's video, we will explore the fascinating world of Wolff-Parkinson-White, WPW Syndrome, and its characteristic pre-excitation patterns observed in ECGs. Wolff-Parkinson-White syndrome is a condition characterized by the presence of an abnormal accessory conduction pathway between the atria and ventricles. This pathway, known as a bypass tract, allows electrical signals to bypass the normal conduction system, leading to distinctive ECG changes. In a normal heart, electrical signals travel from the atria to the ventricles via the AV node, which introduces a slight delay. However, in WPW, the bypass tract enables some signals to reach the ventricles earlier, resulting in pre-excitation. This early activation causes a shorter than normal PR interval on the ECG. The signal through the bypass tract activates part of the ventricles first, creating a slurred initial part of the QRS complex known as the delta wave. Following this, the normal conduction pathway catches up, leading to a combination of the pre-excitation and normal ventricular activation. This results in the classic WPW triad, a short PR interval, a wide QRS complex, and a delta wave. Bypass tracts can be located in different regions of the heart. Their location influences the appearance of the delta waves and the overall QRS morphology on the ECG. For instance, a bypass tract in the left ventricle's lateral part will create different patterns compared to one in the posterior or right free wall regions. Left ventricular lateral bypass tract, negative delta waves in LED1 or AVL, positive in V1 resembling a right bundle branch block. Posterior bypass tract, positive delta waves in most precordial leads, negative in inferior limb leads mimicking an infraposterior infarct. Right, free wall bypass tract, negative QRS complexes in V1 and V2 similar to left bundle branch block. Anteroseptal bypass tract, negative delta waves in V1 and V2, resembling an anteroseptal infarct. WPW syndrome significantly increases the risk of arrhythmias. Patients may experience paroxysmal supraventricular tachycardia, and in rare cases, atrial fibrillation that can lead to ventricular fibrillation. This is due to the reentrant circuit formed by the normal and bypass conduction pathways. During PSVT, the impulse travels down the AV junction and back up the bypass tract, creating a rapid repetitive cycle. This results in a narrow QRS complex and loss of the delta wave during the tachycardia episode. Treatment for WPW syndrome often involves radiofrequency catheter ablation to eliminate the bypass tract. This procedure is highly effective in curing symptomatic tachycardias. Patients who are not candidates for ablation may be managed with medication. Thank you for watching this detailed overview of Wolff-Parkinson-White syndrome and its pre-excitation patterns. For more insights on heart rhythm disorders, subscribe to the Heart Rhythm Center. Don't forget to like, share, and comment on this video. Stay healthy and informed.